Hello, everybody, and welcome to Types of Anemia Vampire Diaries Edition. Oh, okay, so starting with the general signs of anemia. So, when we're talking about the different types of anemia, you're going to see these three common manifestations amongst all of the different disorders, and that includes pallor, which is just being pale, fatigue, as well as shortness of breath. So, starting with our first character and our first disorder, we have iron deficiency anemia, which is going to be characterized as Elena. So, why did we choose Elena for this? Elena is often portrayed as pale, fatigued, and emotionally drained, especially when she made the transition into a vampire. Iron deficiency can cause weakness, dizziness, and paleness, mirroring how Elena feels when she's struggling to adjust. So, in terms of the pathophysiology of iron deficiency, it's essentially low iron, in which the formation of hemoglobin causes inadequate ability to carry oxygen. Now, one of the manifestations to note is that it can cause tachypnea and tachycardia when um, the body is trying to compensate for hypoxemia. And hypoxemia is a lack of oxygen in the bloodstream, right? So that's how you're going to have the tachycardia and the tachypnea, is that compensation effect. Now, manifestations include glossitis, which is painful swelling of the tongue, and then that word right there, which I don't know how to pronounce, and that's just when the fingernails become soft and malleable. So, in terms of iron deficiency, anemia, interventions, and management, first things first is activity and tolerance. So, you want to educate your patients on the use of shower chairs as well as potentially offering them a bed bath. And you also want to educate them on spreading out activities and allowing rest periods. Now, the goal for patients with IDA is to ambulate without fatigue. So that means that you're going to want to monitor vital signs as well as the oxygen saturation. And lastly, you want to teach patients about the risks associated with medications and how to improve their diet. So, with medications, it may cause dark, tarry stools, and then foods that you need to educate your patient on is going to be beets, meats, dark green veggies, legumes, and eggs. So the next disorder is vitamin B12 deficiency, and we have Damon as our prototype for this disorder. Now, this is also referred to as pernicious anemia, which is going to affect nerve function and mental clarity, sometimes causing mood changes. Now, Damon's erratic emotions, impulsivity, and moments of deep exhaustion could represent the neurological and the cognitive effects associated with B12 deficiency. Now, B12 is required for normal central nervous system, red blood cell, and DNA function, and this is caused by a lack of intrinsic factor. Now, this is introduced into the body via meat, seafood, eggs, and dairy. And studies have not found any sources of plant products that can, allow vitamin B12 to be entered into the system. So it's important that you're educating the patient on those foods for this system. Now, because of the effects, like I said, it can lead to spinal cord degeneration, peripheral neuropathy, altered mental status, and visual disturbances, right? Which are all kind of manifestations that are true for Damon. Now, other things include, again, the shortness of breath, tachycardia, dizziness, and fatigue. Okay, the next disorder we have is folic acid. Now, folic acid is essential for red blood cell production, and its deficiency can lead to weakness and confusion. Now, how does that relate to the Vampire Diaries? Well, Stefan struggles with blood cravings and self-control, which can symbolize the body's the body's inability to function properly without this crucial nutrient. So folic acid it's involved in DNA synthesis as well as cell maturation and replication. Decreased folate levels can delay erythrocyte maturation, lowering hemoglobin levels and causing anemia. So manifestations again, pallor, tachycardia, tachypnea or tachypnea, dizziness, and fatigue. Now, increased risk of bleeding is one of the common concerns for this disorder. And to manage it, you're going to manage with folate intake as well as supplementation. It's important to note that for patients that have that are pregnant, you want to make sure that they're consuming folate to prevent any neural tube deficits in the babies as well. And now some sources for folic acid include fortified cereal, legumes, green leafy vegetables, yeast extract, and nuts. So, next is sickle cell anemia. Now, sickle cell anemia is characterized by misshapen red blood cells that cause painful blockages. For our prototype, we're going to use Klaus. Klaus is a hybrid who is literally torn between two bloodlines, being a vampire and a werewolf. He's often in pain from this dual nature, and his internal struggle and resilience mirror the challenges of having sickle cell disease. So, again, sickled red blood cells are going to become, sorry, one second. Sickled red blood cells become stiff and they lose flexibility, which it causes cells um, the ability to carry less oxygen, which makes the cells more fragile. Now, abnormal cells can also clump together to form thrombi, and the hemolysis can lead to the actual anemia part of it. Now, some of the manifestations include anemia, which again, fatigue, pallor, shortness of breath. It also can cause vaso-occlusion of the blood cells, which can result in pain and swelling. Any tissue may experience vaso-occlusion and tissue ischemia. However, pain usually occurs in the joints, the bones, chest, and abdomen. And then, so long-term organ ischemia can lead to growth and developmental delays. So that's one of the important education aspects of this disease, right? Children with the disease might be more smaller than peers, and puberty it can lead to a delay in sexual characteristics, including late menstruation for females. So, some patient teaching that is important includes the pathophysiology of disease. So, parents, especially for children, need to understand that the disease is unpredictable. Additionally, it's important to educate on the infection prevention measures. Because patients with sickle cell are more prone to infection, you want to educate them on updated immunizations, as well as flu and pneumococcal. You also want to educate them on good dental hygiene, as well as checkups and careful monitoring of cut sores and insects bites. And that's all to minimize the risk of infection. Additionally, you want to educate them to avoid cold temperatures and wearing tight clothing as it can cause vasoconstriction. Another thing too is genetic counseling. There is a risk of inheritance with this disease. It's genetic, and both parents must be either carriers of the trait or have sickle cell in order for the child to have or inherit the condition. Another point of education is to avoid high altitudes and depressurized airplanes. Areas with low oxygen tension can cause sickling of the red blood cells and can cause a sickle cell crisis. It's also important to educate them on avoiding overexertion, as this can cause stress on the cardiovascular system. Additionally, these patients, it's important to give them sense of hope and educate them and encourage them to live as normal of a life as possible, um, and provide them therapy and counseling. Additionally, it's important that these patients are adequately hydrated. So, sickle cell crisis, when it comes to that, you want to, again, avoid triggers like sport, infection, dehydration, blood loss, and high altitudes. Some priorities for this condition is pain management, and we can treat sickle cell anemia with analgesia like opiates. Now, hydration is super important because this is going to minimize the risk of kidney failure that can be associated with the disorder. Sometimes you might need to do blood transfusions because of the fact that, the cells are just so badly misshapen and oxygen's not being carried properly. And the priority assessment is going to be the oxygen saturation. If it is low, you can give nasal cannula oxygen 3 liters a minute. Our next disorder is aplastic anemia, and our prototype is Bonnie. Now, why Bonnie? Aplastic anemia occurs when the bone marrow fails to produce enough blood cells, leaving the person weak and vulnerable. Now, because Bonnie frequently sacrifices her own energy, like her magic draining her life force, it can parallel to the body's struggle to replenish the blood cells. So this disorder is going to result in something called pancytopenia, which is a decreased production of all the cells, right? White blood cells, red blood cells, and platelets. Now, clinical manifestation, again, are those standard anemia symptoms, increased susceptibility to infections, bruising, nosebleeds, and it can also cause bone marrow depression secondary to hepatitis and HIV. So, in terms of patient teaching, you want to avoid exposure to potential infections. For example, crowded places like concerts. And this is because due to the decrease of white blood cells, it makes your patient more susceptible to infection. Additionally, you want to educate them to report all temperature elevations because of that bone marrow depression. You also want to avoid activities that can cause trauma or injury because this can increase the risk of bleeding due to thrombocytopenia. And then you also want to educate them on having adequate nutritional intake to enhance immune function and reduce the risk of infection. Okay. So next we have Caroline Forbes, and she's our model for thrombocytopenia. So thrombocytopenia, which is a reduced number of platelets, causes excessive bruising, prolonged bleeding, and issues with clotting. Caroline, after turning into a vampire, struggled with her newfound fragility and healing process. Her transformation can parallel how thrombocytopenia in patients they have to have caution when it comes to injuries and bleeding. Now, a key component here is platelet count. The normal platelet count is 150,000 to 450,000, so make sure to remember that. Now, again, those manifestations, right? Easy bruising, petechiae, bleeding from the nose or gums. And in terms of assessments, you want to assess platelet count and for ecchymosis, which is bruising, and then frank bleeding, so again, bleeding from the nose. And then some of the actions that are important is to implement bleeding precautions, which we're going to talk about on the next slide. You want to minimize blood loss from any lacerations or vacupuncture, so that includes like blood draws. You also want to avoid IM injections as it can cause bleeding to the muscle, which would be difficult to manage. You also want to avoid any rectal temperatures, enemas, or suppositories as it can lead to bleeding in the anus, rectum, and the vagina. And you also want to teach the patient about, again, those bleeding precautions and how to minimize the risk of bleeding. For example, like holding pressure to certain areas. So, in terms of bleeding precautions, you want to use soft toothbrush and soft foods, electric razor when shaving, daily stool softeners to prevent constipation, right? Because if we're constipated, it's going to be harder for us to actually defecate, and that can cause hemorrhoids and can cause bleeding. Key point here, do not blow the nose, right? Because blowing the nose can cause a lot of force and pressure, which can cause bleeding. Avoid intercourse with extremely low counts, platelet counts. You want to hold direct pressure to the wound, and do not use a machine blood pressure. You want to use a manual blood pressure cuff. Our next disorder is leukemia, and this is going to be modeled by Jeremy. Now, leukemia is causes by an unknown stimulus that mutates the myeloid or lymphoid stem cell. So it makes the body vulnerable to infection and extreme fatigue. Now, Jeremy, as we know, has been through so many different deaths. He is just like a cat that has 9 lives but has lived 15 lives. He struggles with weakness, loss of recovery, symbolizing the fight against leukemia. Patients often present with fatigue, pallor, weakness, shortness of breath, as well as bruising, fatigue, nosebleed, bleeding gums, as well as frequent low-grade fevers. So those are some of the manifestations. It can also include swollen lymph glands, and then anemia, neutropenia, and thrombocytopenia. So remember, these characteristics might come up a lot with other disorders, so it's important to know the manifestations of all three of those things. Now, diagnostics-wise, it's going to be a bone marrow biopsy. So that's super important to note there. Now, to assess improvement, you want to monitor lab values. So white blood cells are going to increase, platelets are going to increase, and then you're going to have an increase of folate, iron, and B12. Now, one thing that's important is even a slight temperature increase can be very significant for the patient, so make sure you're monitoring their temperature. And if they're undergoing chemotherapy, you want to make sure you obtain an order for nausea, vomiting, and diarrhea, as well as antiemetics. Now, some of the actions is administering chemo as prescribed. You want to institute neutropenic precautions, which we're going to go over 2 slides over. You're going to use the prophylactic use of antibiotics, antivirals, and antifungal, and this is going to serve as protection against infection when those neutrophil counts are low. Additionally, you want to do that symptom management of the nausea, vomiting, and diarrhea, as well as administering oral blood products. Now, in terms of neutropenic precautions, this includes frequent hand washing or the use of alcohol-based hand sanitizer by the patient and others coming in contact, right? Because of the fact that their neutrocytes are low, it places them at risk for infection. Now, you also want to avoid crowds, right? As well as sick people. You want to wash all fruits and vegetables before eating. You want to monitor temperature. And then you also want to avoid standing water and appliances like humidifiers because it can cause bacteria and mold in there. You also want to avoid any live plants or cut flowers in the home environment because they are grounds for bacteria and mold. So there's some other things as well, but this is just a general overview. Okay, our next disorder is malignant lymphoma, and this prototype is going to be Catherine. Now, why? Lymphoma is a type of cancer of the lymphatic system that can lead to swollen nodes, fatigue, and immune dysfunction. Now, Catherine is constantly on the run trying to survive despite her body failing her, especially in her final days as a human. Her declining health and resilience can align with lymphoma's progression. Now, manifestations, right? It includes painless swelling of the nose, nodes, low-grade fever, night sweats, fatigue, and unexplained weight loss. So key points here is discharge instructions. So that's going to include hand washing, flu, COVID vaccines, monitoring temperature, avoiding crowds, isolating as needed, and preventing complications. Some things that we can do as nurses is blood products, anti-neoplastic agents, IV fluids, and symptom management. And that is pretty much it for malignant lymphoma. If you look in the notes section of the PowerPoint, it goes more into detail, but this is just a general overview. Now, the last disorder that I have here is multiple myeloma, and our prototype person for this is going to be Alaric. Now, multiple myeloma affects plasma cells in the bone marrow, leading to bone pain, fractures, and immune suppression. Alaric, as a human, suffered from multiple injuries and illnesses, but kept fighting onward. His body wears and tears over time, which parallels to multiple myeloma, which weakens the body's immune system. So this is an incurable B-cell malignancy, and it's also called monoclonal gammopathy. Manifestations: anemia, bone lesions and pain, renal insufficiency or failure, and hypercalcemia. Some actions is going to be administering chemotherapy, as well as biphosphonate therapy, which is going to reduce breakdown of bone tissue, which essentially is going to help with the risk of fractures and skeletal complications. You also want to administer pain medications, right? Because bone destruction is painful. You also want to increase fluid intake, right? Because of those increased calcium levels, we want to make sure that we're flushing that out of our body, because we want to prevent things like kidney stones. You want to teach the patient about the manifestations, including the fatigue, shortness of breath, dizziness, and confusion. You want to make sure you're educating the patient on reporting any sudden onset of severe pain, because that can be very vital for this disorder. And then you also want to educate them on reporting any changes in sensation. So that includes increased numbness or tingling, changes in motor function, and things of that nature. So that concludes my presentation on the types of anemia, Vampire Diaries edition. I hope this video was helpful, and if you have any questions, let me know.